My name is Veeral. I'm a gastroenterologist, a physician. But more importantly, I'm a son, a brother, an uncle, and also, like many of you, a patient. Let me tell you two stories. First is that of a young 6-year-old boy who stopped his father from going to work by simply saying, "Daddy, I can't breathe." His father rushed over to his son, noticed he was gasping for air, took him to the emergency room where a doctor, followed by a nurse, walked into the emergency room and listened to his chest, his heart and lungs. They turned to the family and said, "This is nothing. This is only asthma. We will give him some treatment and he will be fine." And then they walked out of the room. The second is that of a young doctor in training who walks into a patient's room confidently to describe a procedure known as an endoscopic retrograde cholangiopancreatography. Kudos to anybody who can spell that. He walks into the patient's room and looks to the patient and her family and says, "So, looks like there's a stone stuck in your bile duct. We are going to do an endoscopic procedure where you will be sleeping. We will go in from the mouth into the area where these bile ducts open up in the small intestine. And we will do the procedure called an endoscopic retrograde cholangiopancreatography, or ERCP for short, and remove the stone." Now think of that image in your mind. In both of these cases that I just described, there's an obvious problem. There's also one commonality between these two cases: me. In the first, I am the 6-year-old boy who stopped his father from going to work. It was my parents who were told by the physician and the nurse that he has only asthma and nothing to worry about. For my parents, asthma was a new word. They had no idea what that meant. It was a new word for their vocabulary. For them, it could have meant leukemia or cancer. Fear for their son had replaced their senses. In the second, I am the physician in training who went into my patient's room and used medical jargon and somehow expected them to understand. I mean, who in their right mind is going to understand endoscopic retrograde cholangiopancreatography? While I quickly rectified my words, it became clear to me that everything I said to that patient after that long form of ERCP was essentially in Latin. And it dawned on me that what asthma was to my parents, ERCP was to my patient. These two cases illustrate a larger problem we have with our medical system, a problem that is so important and can be summed up in just one word: communication. Perhaps the physicians and healthcare workers are not communicating effectively with our patients. Or perhaps patients are not understanding what the doctors and the nurses and all the healthcare workers are telling them. And maybe that is the reason of some of the larger problems we have in our medical system. Problems such as medical malpractice, defensive medicine, and medical noncompliance. A study by the Harvard School of Public Health in 2010 revealed that approximately $55.6 billion was the total cost of medical malpractice. $55.6 billion, or approximately $56 billion. Of that number, $45 billion was the cost of defensive medicine. What is defensive medicine? Defensive medicine is where healthcare workers order additional tests or additional referrals are generated simply for self-protection. Is $56 billion a big number? Well, if you think that's a big number, how about $289 billion? $289 billion. That is more than $250 billion. That, my friends, is the cost, economic cost, of medical noncompliance. That number was published in the Annals of Internal Medicine, a prestigious medical journal, by the Research Triangle Institute. And the authors of that study concluded that, among other things, patient education and support helped in improving compliance. To give you an idea of how big that number is, if you take $1 billion and in $1 bills and start forming a tower from the ground up, $1 billion will form a tower that is 68 miles high. 68 miles. But we're talking about $289 billion. That is 289 times 68. That's approximately 19,000 miles, more than that. That number is so great that it's higher than the orbit of the International Space Station. That's how much money we're talking about. So we all should care. So how can we in the medical system help communicate better with our patients while reducing costs and improving anxiety? And that's where video medicine comes in. Video medicine is where we use animated videos to describe to the patient specific procedures they're about to undergo, or explain to them their diagnoses. So for procedures, for instance, we could talk to the patient while we're getting consent, which, by the way, right now we do it in paper form, and we talk to the patient drawing diagrams and things like that. But what if we took the same amount of time and showed them an animated video on the actual procedure they're about to undergo? Seeing is believing. And I believe that once a patient actually sees the procedure that they're about to undergo, whether that's an endoscopy procedure or a knee replacement or a bypass surgery or even a heart transplant, once they actually see in animation form what the doctor is about to do, they will be able to understand the actual procedure, but also more importantly, the intricacies of the procedure. They'll be able to better ask questions pertaining to any potential complications of the procedure and what the doctor may do should those complications occur. Furthermore, this consent process could also be recorded, making it part of the patient's medical record, thereby preventing any future misunderstanding or legal complications. So that's great for a video consent process, but how can we use this video process to improve patient compliance? After all, when we talk about patient compliance, what we're really saying is we want patients to change their behavior. We're trying to get obese patients to eat healthier. We're trying to get obese patients to do exercise more regularly, or smokers to quit smoking, or other similar behaviors. Studies have shown that in order to induce a change of behavior, inducing an emotional response in any human being is more likely to succeed than not. So how do we do that? So how about we talk in a video form on specific conditions afflicting our patients and show them a 5-minute video on a condition that afflicts them before a doctor comes and talks about the rest of their health care. So for example, you could show a 5-minute video on smoking and smoking cessation and show the patient the social and financial impact of smoking, or social and financial impact of obesity, or social and financial impact of high blood pressure. When can we show a video like this? Because if you ask any of my colleagues, including myself, we will tell you that it is very difficult to find 5 minutes in addition to all the time we spend with our patients. If you have 20 patients a day, 5 minutes per patient is approximately 100 minutes. That's a lot of time. So in order to find these 5 minutes, I went to a patient waiting room. And I just wanted to see what the patients were doing while they were waiting to be called in. And I found they were reading Time magazine, National Geographic magazine, Lifestyle magazine, She magazine, but very few places actually have medical journals or anything healthcare pertaining. I found some patients reading while they're waiting in their little doctor's office as well, not just in the waiting room. Don't you think it's a better use of time where you spend 5 minutes watching a video on a condition that afflicts you, that talks about the impact socially and financially to you, than reading about the next travel vacation or picking out your next dress in a doctor's office? We have the tools, the technology, and I know my patients want to know more about their health. They want to improve their overall condition. You know, studies have shown time and again that the healthcare profession enjoys a level of trust in society that no other profession enjoys. That is true across borders and across cultures. That inherently means that we as a people, as a society, trust our healthcare system and specifically our healthcare workers. This means that if you present information in just a slightly different manner, it can lead to increased trust, better compliance, decreased costs, but more importantly, decreased anxiety for all patients and their families, such as the family of that 6-year-old boy with asthma. Thank you all for listening.